All right, we can go ahead and start our next seminar. This one is on back pain and kissing spines. I'm Alex Beckstett. I'm the managing editor of the Horse Media Group. As Stephanie said earlier, we produce the monthly horse magazine, thehorse.com, and Off Track Thoroughbred magazine for the RRP. Like I said, we'll be talking about back pain and kissing spines. If you all have questions, if you could raise your hand so that we can get the mic to you so that our online audience can hear the questions that you're asking as well. And if you are joining us online, you can submit your questions in the chat box and stick around till the end for the door prizes. So our two experts today for this topic are Dr. Lark Carroll and Dr. Colton Thacker. If I can get this to work. Door prizes. Oh, and it's sponsored by Root and Riddle. Thank you very much for sponsorship. So I will have our experts introduce themselves and tell us a little bit about them and their background. I'll start with you, Dr. Carroll. If you can tell us about your background as well as your experience in the thoroughbred industry.
Yes, so my first name is Lark Carroll, and I went to Ohio State for veterinary school, came out, did my internship at Root and Riddle under Scott Pierce. So we did predominantly, we were involved with thoroughbred racing and sales. In that internship, I went on to become a track practitioner from there, and it segued into adding more and more alternative therapies, educating myself in alternative therapies, specifically chiropractic and acupuncture work to augment my lameness diagnostics or physical exam. And it was a realm of medicine that drew me further and further in, and I decided it was something that I needed to do a lot of to be good at it and use it integral in my daily practice. And so by doing a lot of it, it snowballed, and I it became my whole concentration as of 12 years ago. So my practice since then has gone 100% acupuncture, chiropractic, and other therapy modalities since then. And my background in the thoroughbred industry is my dad was a trainer. I grew up being on the backside with various jobs, including exercise riding through high school, through college, through vet school, and beyond. And I owe everything, including my existence, to the thoroughbred racehorse. That's how my parents met. That's been how I've earned every penny. So I have a huge reverence for the thoroughbreds as athletes, and it's become my life mission to support them in their various sport horse demographics, and it's been extremely rewarding.
If I could just ask you guys to make sure you speak into the mic, you have to get close to it. Thank you. Dr. Thacker, if you could give us a little bit of information about yourself as well.
Yeah, so I'm, I guess, a Utah transplant. I'm originally from Utah. Grew up in Utah, mostly at the quarter horse world, West Performance and rodeo. Grew up there. I went to Utah State on a rodeo scholarship there. Went to school at Washington State University. Came here to Root and Riddle as an intern, thinking I'd be here for a year, and been here for about 6 now. Following my internship at Root and Riddle, that was mostly reproduction focused and sale work. I spent a year in the hospital with an imaging fellowship and lameness, and that's what my practice is now, is mostly ambulatory imaging and lameness and pre-purchase sale exams. So as far as the thoroughbred industry, I do a lot of thoroughbred racing here in Lexington, Kentucky, racehorses. I do service a few nonprofit thoroughbred aftercare facilities and stuff that have rehoming groups. And so I've had quite a bit of horses that have come in with issues and had to try to rehab them and get them to find them new homes. So I think there's actually a few of them that have competed here this week. So yeah.
And I know that back pain and back conditions is a very broad topic, and there are many, many causes related to the back and not even related to the back. if you guys can maybe give us some of the more common things that you see in these horses, or maybe explain for the audience the difference between primary and secondary issues that they might see in their horses.
As you can imagine, in my realm of practice, especially with a concentration in chiropractic and acupuncture work, I see the whole spectrum. There is obviously primary back pain, and a lot of times I see secondary back pain to low limb changes. Just take it for instance, foot pain. And we will start there because you see a plethora of racehorses come off the track, transitioning out of shoes or onto different surfaces, different husbandry, really struggle with thin soles, foot soreness, and it wreaks havoc on their axial skeleton, meaning it can wreak havoc in their neck, it can wreak havoc in their mid to low back, it can wreak havoc in their pelvis. So sometimes it gets to a point where it's hard to weed out even where the fire started necessarily. But that is a perfect example of one causing the other. And you can go through different extents to that's a blatant example. But there's also other examples of low limb changes that will affect the back. Depending on what discipline they're going into, that's another factor.
For myself, back pain is a very complicated thing. There's lots of horses that are have a lot of variations in how they display clinical signs of back pain, and it's really a challenge to figure out, is this real back pain or not. There's horses that have quote unquote a cold back when they're first being broke as young horses, and so is that true back pain? And so I think that's where it really starts. Back pain starts is what is truly a pain response, and what is that horse's behavior, or that horse's just their sensitivity. And most importantly, that the back is an important part to the horse as a whole. There's lots of things for proprioception and neuro and vascular things within the back, the soft tissue structures as well as bony structures and everything that help that horse to move and to perform. And so it's an important piece of the puzzle, and that's why it's so, I guess, a hot topic.
And I would add that conformation is another huge component of this. So when you're looking at a horse, just even the structure and scope through their neck, the length and composition through their back, and then even how the forelimbs, accommodate around this. So there can be angular limb changes, meaning low limb changes or conformation that can lead to changes or different presentations we see through the back.
So with so many possible causes, if a horse is presenting with back pain or presumed back pain, what are the steps that you guys would take on a client's horse to pinpoint the issue?
I start all of my exams with thorough history. You have to have a clean and thorough history. If it's an owner or if it's a seller, or you need to have a history of why they feel that this horse has back pain, or what does this horse do as a career, what's his job. That's the first step that I start with. If you don't have that thorough history, it's really hard to decipher what's real and what's not real as far as pain response.
I would 110% agree with that. You have to put it into context. It really does, because it tells you how significant the findings are in your physical exam. I want to know, has this horse raced? How many times has this horse raced? If I'm looking down at their feet, is this a change in shoeing? Have they had a change in surface? Have they had a change in paddock arrangements? Have they had a change in workload? Are they on any medications currently? Were there any medications tried? How did they have a response to that medication? It is an accumulation of those details that will help greatly put the whole puzzle together. And sometimes it's sequential exams that make a difference. And I'm sure you experience the same thing. You'll have a horse in front of you and you go, well, let me come back and recheck this horse in a week or two and see where we are then, because it's almost like having two snapshots. You have an x-ray from this, not a literal x-ray, but a physical exam snapshot of this day in comparison to that day. And you can say, okay, our mountain, this is a molehill or this is Mount Everest in comparison to your findings.
And I think because back pain is a lot of times in cases that I see is secondary to some other lameness or some other issue that the horse has. And so you really need to treat the primary underlying cause first before just treating the back pain. There's modalities you can use to treat the back pain. Yeah, it treats its back pain, but what is the underlying cause that's causing the horse to be that way?
And the spin off that, so much of this can be the onion layer too. There might not be, sometimes it's a threshold issue. It may not just be one thing accounting for the back pain. There's actually 5 things. And if you had one of the 5, the horse would be none the wiser and you wouldn't be seeing the presentation you are. But when you have all 5 of those things, the horse has, been thin soled and trying to transition out of shoes, after his racing career 6 months ago, also has kind of a rough buddy in the field, also now has, is being worked 5 days a week, also in a saddle that's not fitting great, but we're waiting on the new custom saddle that's going to take 3 months and 6 months. And then by the time it gets there, it doesn't fit the same because now the horse has filled out, and, that just can compound and compound and compound. So it takes a lot of titration. And I tell people, let's not get frustrated off the bat. It takes titration. And if you can back down 1 to 5 of those contributing factors, that's when we'll start to get this under control, is the premise.
And does anybody have any questions about specific issues or causes of back pain that you might be seeing in your horses?
Specifically in race horses, horses that have been raced when they're too young really and not as mature with it, so their hind end is high and their shoulder is low. Do you see more back pain in that kind of conformation?
Honestly, that it starts to get into another debate when you talk about horses that are too young to compete or race. It is because I don't see that connection really. It's not A plus B equals C. It's not a black or white situation. There's actually a lot of gray in there. So I rarely see a horse that is downhill and going through an awkward growth stage that end up running. Usually that precipitates another issue. They end up with shins. They are downhill, unbalanced, overloading their front end up with shins. They're not going to the races then, and not that that's how it happens every time, but that's just an example. There's actually surprisingly a lot less back pain in those younger horses on the track. I see way more back pain and issues with these horses that are transitioning to a new discipline off the track. Part of the reason is there's a different level of baseline and conditioning that is put on those horses, and saddle fit is not an issue. You would think it would be. It is not an issue there. I've never seen one on the track be sore because of an ill-fitting exercise saddle, unless it was a broken tree situation. And that's not even, there's not too many riders that are going to climb up on one and not have an issue with a broken tree. So it's ironically not an issue, as big of an issue. You'll get back sore horses, but it's usually, secondary to sacroiliac joint changes, and that could be growing pains. But that gets surprisingly managed. And because they have such intense core strength, they do very, very well. And that's what we're starting to see a change. You know, you see, if you walk around here, you'll see various booths that are starting to focus on how we can change balance and core strength and proprioception in these horses. You even touched on proprioception, and I don't know if everybody knows what that term means, but it's how a horse is able to unconsciously balance themselves and maneuver through their environment and stay balanced. And so it's using intrinsic muscles like your multifidus, little tiny muscles that we wouldn't know or think about. We're looking at gluteal muscles, we're looking at the big apaxial muscles, but what we don't see, and what's probably even more important, are the little tiny intrinsic muscles. So we're starting to see physical therapy and just ingrained training and trends that are focusing on core strength. And I think that is absolutely the direction we need to go to see less back pain in general.
Can I have a second question? So the psoas muscle that's on the interior that you really can't palpate so much from the outside, how do you all diagnose that psoas being the problem? It's that major muscle that goes all the way through and then goes through their pelvis and into their hind leg. Also, sciatica can be caused by that.
Yeah, I think that's where it gets tricky sometimes, you know, because there are so many different muscles within that region and so many different structures. You know, you have your supraspinatus, so your ligament that goes along the top of the dorsal process of the vertebrae, and then you have the facets, and then you have all the musculature that goes down through there. And so it can be very challenging to say, hey, it is just the psoas muscle, or it is just the multifidus that's causing the issue. And I think that's where your diagnostics as a veterinarian come in with local blocks. So you're with anesthetic, you know, blocking the horse, and then deciphering which imaging modality you're going to use. You know, there's different things we can do. A lot of people are familiar with x-rays, you know, that's for seeing bone. But what's really becoming more popular to see the bone surface as well as the muscle and the architecture of the muscle is ultrasound. And so the psoas can be hard to see on ultrasound. And so that does bring a challenge. But, you know, I think it really comes down to, you know, talking what we talked about earlier, is look at the whole horse, you know, like identifying, you know, identifying and then ruling out things that are a possibility as well. So you might go with the radiographs, rule out bony abnormalities, rule out ligament injuries, rule out primary, you know, neuro disease, or, you know, primary lameness issues, and then say, hey, well, this is what we're left with, is some sort of muscle disorder or something like that. So it's really a ruling out of DCs for me.
And I would say, like, especially with something like the psoas. So I think it's a curious focus that has come up. It's certainly a coined thing and a real thing in the human world. It's very rarely do I think we're just dealing with the psoas issue. You know, it would be extremely real, and especially in a horse, because you're dealing with a quadruped and totally different, even though you have a skeleton structure, very, very different mechanics there. So my point is that it's going to be, there's going to be, if it's just a psoas issue, then you have a train wreck there. So there would be other muscle groups that are going to trigger you, and you can suspect that the psoas is involved. I can't think of one case that I've said this has to be the psoas, period. So that's just an example. And that's kind of what we were talking about before this discussion even started. There, it's a very layered, injury, complicated topic for that reason. And diagnostics are super, super challenging in this instance, especially when it comes to the back. We're very limited by how clear those images can be. We're also limited in the one angle of that image you can have, so you can't see it from multiple views like you would if you're x-raying a lower limb. you would be totally amiss to take one view angle of that. You take some cases 4, 5 and more. And we are totally limited to a one view angle, which I think complicates the diagnostics greatly, extra complicates the significance of any findings you have on there, because you can't answer some of the questions you'd have about the changes through the whole region. You know, it's not as simple. If you had a back injury or issue, you know, they wouldn't hesitate to send you for the MRI. And so again, those things tie our hands a little bit, and it all comes down to history and very, very thorough clinical exam.
We have a couple questions from our virtual audience. Before I get to these, can I just remind you, Dr. Thacker, to move the mic a little bit closer? They only pick up so much sound. Thank you. So Michelle is asking, how do you balance rest for healing pain versus keeping the horse in work to build their and maintain their muscle, their top line muscle?
For me, it's starting with the core muscles and giving adequate rest if there is an injury, but then keeping them moving. You know, for me, for example, if I don't do any activity or work out for a while, then all of a sudden I go back to the gym and I feel it the next day. And the horses, there's no difference with them. And so, you know, there is a period of rest, but then there's also a period of slowly building back up to where they are in full work. And so for me, it's an individual basis. There's not one protocol to say, hey, you need 10 days off, you need 7 days walking, 5 days trotting. That doesn't exist. For me, it's, you know, okay, we're going to give the horse 2 weeks off, stall rest or turnout, and then we're going to start back, maybe jogging 5 minutes. And we look at the horse, we evaluate the horse after 2 or 3 days and say, hey, nope, he's getting sore again. We need to back off. So then he goes back to turnout. You know, so it may be 1 step forward and 3 steps back for a little while until you get to that sweet spot of where that horse needs to be. And so for me, it's reading the individual and reading the problem that you're treating. You know, and that's what can be challenging is that sometimes you're treating these horses and you don't really know the problem. You know, for whatever reason, clients can't afford to pursue diagnostics that may be helpful in diagnosing it, or you know, they may be trying to get to a show and all they want to do is just go straight to injection or straight to acupuncture or something else that's simple that they've had luck with in the past. And so to really truly treat it, I think it has to be an individual basis and monitored specifically for that patient.
And I'll just add on with this. It's, and this is what you were getting at. It's 110% a titration. So stall rest wreaks havoc on a horse in other ways, you know, mentally, back can be an issue. There's more than one ways that stall rest can. There are some conditions that clearly need stall rested. You know, we have a pelvic fracture, you know, we have another type of this or that. That being said, it becomes 100% a management issue too. You know, say we want a stint of the situation calls for a stint of hand walking. Well, hand walking may be very easy to talk about, but when you're out there walking a horse that had 2 weeks of stall rest and on the end of a shank, and they're doing, you know, you've got a kite on a string out there, like that's not doing anything for what you just rehabbed for 2 weeks. So maybe that's not the idea. Maybe we need to have better living through chemistry, use some tranquilizer and or sedation to get them out of the transition, them out of the stall. Maybe tack walking is actually better in this instance because you don't have the kite on the string. In some cases, you actually have better control, and you also can use them it's amazing what you can get accomplished at the walk. You know, it's amazing. It's amazing, especially if you can have their mind into it. So maybe they do need 2 weeks 10 days, 2 weeks, a month of tack walking. But it's amazing what you can get done in that under a rehab situation. So no, and the other thing is I think it's been easy in our community to say this horse needs 30 days of stall rest, 2 weeks of hand walking, then small paddock turnout for 30, this and that. In the human PT world, in the human physical therapy world, that is unheard of and archaic. So now we're changing our focus to a different way. So now we're looking at physical therapy in a different manner on the equine side of things. And that's exactly, so the mindset's starting to change. Like it's not the cookbook of 30 days, 2 weeks, X, Y, and Z. It is very, very individual based, because my one horse that can handle the 2 weeks of stall rest and then, politely tack walk for 6 months, it is not what I'm going to find at the next barn. And the horse has had 2 days of stall rest and he's a whirling dervish and has a racetrack built up in his stall, which has done nothing for whatever we were stall resting him on. So it's all over the board.
I have another question from our virtual audience that is getting into kissing spines, which we did promise to talk about. So I'm going to put up a slide that one of our artists did to kind of show you what's going on. Jenny's question is, my horse has been diagnosed with kissing spines in T13 through 15. So far, he's had mesotherapy and oral methocarbamol. He's doing well under saddle at the walk and working on core strength with groundwork, equiband, and planning to use a Pessoa rig. How long should I wait to try trotting under saddle?
I can't give you a time of how long you should wait to start him under saddle, but that is a common thing that's being diagnosed now is kissing spine. What people forget to understand, I think a lot what I see is that even though there's a radiographic change there, that may not be the horse's primary issue. So my recommendation would be to start back at step 1 and determine if that is the horse's issue. If has he been blocked there? And has he been treated? What diagnostics have been done for that? Yes, conservative management that she talked about with methocarbamol, mesotherapy, and others. That's a great place to start. But I think blocking the horse needs to be blocked to confirm that is the horse's problem. And then after that, it's a matter of working with your veterinarian and whoever's examining the horse to know, like, hey, we've given sufficient time for these treatments to help. And if they haven't, then what's our next step?
Okay, and then this is getting into my soapbox and realm, because, motion palpation of that region, that's part of the physical exam. So how is that horse reacting in that region? And also what she didn't bring up in that, and maybe she's addressed, is saddle fit. That region is right. I mean, you couldn't be more intimate with the saddle through that region. So saddle fit is a huge question. If those things haven't been addressed and evaluated and taken into consideration, then let's not go right back into work. And some of that gets complicated because maybe there was a saddle fitting before this horse had to take a step back, and now we've lost some of that epaxial muscle or muscle in that area. And so even if it's been addressed prior to this, it might need reevaluated before going back into work, starting trotting. Once they get a good base of core strength, and the equiband is a great, she mentioned that, those different tools we have in our toolbox now can be super. But again, it's not like, for her, I would have questioned more. What were the clinical signs that even prompted you to have that horse's back x-rayed? And was there something more than just the x-rays that diagnosed the kissing spines? And please tell me you didn't Google kissing spines and then decide, because that's a really bad way to ever look at that condition. I would have to ask more questions to get a more poignant answer, and it still wouldn't come with a time frame necessarily.
She actually followed that up with, would shockwave therapy or something like PRP be a good next step before going to corticosteroid injections? But I imagine you guys are going to have a similar response to that.
Yeah, so I guess there are several things out there that people are using to treat backs medically or conservatively. And, you know, she mentioned corticosteroids. Those, in my opinion, are pretty quick acting. They get to the point, they are decrease inflammation. They may not last a long time in the horse, so you might have to repeatedly do them. You know, there's biologics now that they're using, IRAP, PRP, Prostride, other things like that. They're also to decrease pain receptors, to decrease pain in that area. You know, so those are options. Acupuncture. I've had a lot of horses respond with acupuncture. I've had them respond with shockwave in conjunction with the injections, as well as laser. It goes back to the horse. You know, what is that horse responding to? You know, if he's not responding to the mesotherapy, not responding to methocarbamol, then yeah, I would say it's time to try something different. But you know, you can spend a lot of money and time treating a horse with any of these conservative things, and it still may not fix the problem that's at hand. And so that's why people are starting to seek out other options that they have, you know, and that's why surgery has become an option for some horses, and it's kind of a newer thing. But before you get to that, that brings a whole nother topic, but and discussion. But you know, for me, yeah, shockwave, laser, those things are things to try medically first.
And let's not forget chiropractic. No, and the reason I say it is because, you know, some people are saying, oh my goodness, these are inflamed areas of the back, you know, we shouldn't be doing. What we negate though is you can't get so hyper focused on T13 through 16 and negate the motion that needs to remain and stay healthy in all the adjoining segments. Like and the worst thing that can happen to a joint that is starting to have degenerative changes is to shy away from motion. Motion is going to set up for more degenerative changes. Ask anyone in an aging demographic that is starting to get arthritis. You know, low motion can only beget more arthritis. That's just an example, drastic. So it is super important to maintain the health, even if those aren't segments that are meant to be adjusted at that time. Do not negate the importance of the segments above and below it. Super, super important. And sometimes it is warranted to work on those, at least from a mobility standpoint. It may not be a high velocity adjustment in that region. Usually that's counterindicated, but it may be a mobility thing there. So super important, because our goal is to get the horse comfortable, to get to a stage that they're building core strength, core muscle, that begets more stability to that region, which begets more comfort, which begets more motion. And then you go the other direction. Then you've got the ball rolling the other direction, and you can get to your ultimate goal. So these other modalities that she's talking or the other treatment options that she's talking about with shockwave and injection and everything, I say, you know, it again, it depends on where our pain level is and how quickly we need it, how much ramp up there has been to the pain pathway, how much it's going to take to knock it down. Because there, you know, there are debates whether corticosteroids can act negatively in these situations over time, having to do with muscle building in the area and everything. So it's not, again, there's not a black and white here. There's a lot of gray zone. You know, can you get immediate relief? Yes. Are there consequences to it? There's always an instance where you're going to rob Peter to pay Paul. So you have to balance out the cost benefit there. Now, I have had horses that have come in front of me and they've had such a ramp up of pain, back pain, that you have to put out the fire. before you can ask them to do any of these core exercises, even if it's balancing on a pad, like it's very individual. And those are the spectrums.
John? Oh, so let's say you've had a diagnosis of severe arthritis in your back there. I've had it recommended to me to do the lig snip or the bone shaving procedure. It just seemed incredibly drastic to me. But so what's your opinion about those two procedures, and what are the consequences long term?
So, yeah, so there are two procedures, what you mentioned. There's the leg split, where they're just going in and they're just cutting the ligament that is between the two dorsal processes. I don't know if that picture up there, you can see basically the two fence posts that are there on the vertebrae. When there's a ligament that goes between them, and then a ligament that goes along the top. And you're going in and you're cutting the ligament between the two fence posts. That ligament has lots of nerves in it, lots of nerve endings and stuff. In kissing spine specifically, it's more of an osteo bone on bone overriding, so it can be difficult to actually get in there and really cut the ligament to do that. It's a complicated area, which we discussed earlier, with muscles, nerves, and vasculature. So it is definitely in my opinion, it's a very invasive procedure. Has it helped some horses? Yes. But if they have really bad overriding processes, and those, there's a lot of remodeling there, it can be difficult to actually get the ligament fully transected in there. When they did the osteectomy, they cut the ligaments as well, but then they will actually trim and shave off part of the bone, so that then the bones are no longer overriding. In my mind, I think that would be more likely to be beneficial for the horse long term. But again, that's going to be a very bloody surgery. It's going to take it takes a lot of aftercare. Most of the aftercare is going to be, hospitalization for 2 to 7 days, IV antibiotics, drain care with that. And then these horses do need to get moving, so 2 weeks, as soon as sutures can come out, they need to be in a rehab program where they're being rehabbed. And, and it's in a rehab program that needs to be followed pretty closely, not just, oh, I saw him 10 days ago. Yeah, let's increase him to trotting. It's a constant forward and backwards. And then there's a study from the Penn New Bolton that just came out in the last year. They had 18 horses that underwent surgery there. They did the surgery with the osteectomy, so the bone was removed. 13 of the 18 horses did improve clinical signs. But the most important part is that only about 5 of those horses came back to the same level of performance or higher. So, is it really benefiting these horses? Even though there's 13 that was improved. And the other interesting thing I find out of this, and it goes back to blocking them and defining that that's what it is that there was 10 horses that had been blocked, and 9 of those 10 horses had improved, whereas the other 8 horses in the study had not been blocked, and only about 4 of those horses had improved. So your chances of having surgery be successful are much greater if you do go through the process to have the horse actually properly diagnosed, properly blocked, and evaluated prior to surgery. And then in surgery, you need to make sure you get all the sites that are an issue. There might be very obvious, 10, 11, and 12 on radiographs, and then say L1 and L2, there might be some suspicious change. You go ahead and fix the ones in the front, the more cranial portion, and the ones behind, don't get fixed. And your problem's not going to be solved. You're still going to be where you were at before surgery. So to answer your question, I mean, it can be difficult to say that I'm going to spend the time, the money to put the horse through that, but it does help some. So.
In my perspective, and to be fair, I almost wish we had a surgeon on the panel, just because, a surgeon fixes things by doing surgery. A practitioner fixes things by what you have access to. And from my point, I'm biased because as a person that focuses on chiropractic and acupuncture, I feel very strongly about the tools I have. So, it's obviously some biased perception here. My biased perception is that those surgeries should be the absolute last ditch where you go, because again, there isn't non-consequences to doing that, and just to pull it over to the human realm perspective, like my mom had a laminectomy at 3 positions in her lumbar spine. Well, guess what? 10 years down the road, it would be even quicker in an athletic horse. 10 years down the road, she's suffering from changes to the adjacent segments. That motion has been taken away from that portion. And so she's suffering greatly from back pain. And so, I think the other thing that some of these studies fail to show is long-term follow through with these cases, that to see what that surgery gets you in 1, 3, 5, 8 years might be drastically different, because between the cost monetarily, the cost physically and imminently with that horse, it becomes a cost benefit ratio. Now, if we have tried everything else, including shockwave, and what I see these cases being and kissing spines and how I describe it to clients is it just takes a lot of maintenance and follow-up. You have to cross your T's and dot your I's. You have to, consider your saddle fit multiple times a year. You have to consider your program, your basic program, your core strengthening program. You have to consider, your goals for this horse too. What are our goals? What is our objective? Is our objective that they're comfortable to maintain, low level trail riding, or are we expecting them to be high level jumpers, things like that. So that's definitely another individual case basis, but from my perspective, it should be the last thing we reach for.
Just one more thing to add. At Root and Riddle, we have yet to do one back surgery. None of our surgeons are on board with it. But then also we don't see that many primary back kissing spine issues. We have horses that are diagnosed with kissing spine. That's not their issue. Their issue is a lameness that needs to be resolved. Once that's resolved, the back pain can be easily treated with other modalities, and then the horse is back in performance. So, that circles back to that key thing, that the root thing is like, what are we treating and why are we treating? And so that's my take on the surgery, I guess.
Well, and I know you're pending with a question. Just one more thing to add to this is, and we were talking about this before, what I really, really, really fear is that a horse will present with back pain and will the universe will jump to radiographs, and we see changes on those dorsal spinous processes, and that's it. That horse just got a label. It is kissing spines, period, end of story. What I'd venture to say is, if you walked up that aisle with the 20 other horses and there have been studies on this, and you can rattle them off way better than I can, but you x-ray the other 20 horses in the barn, you're going to have some horses that have worse changes than that. And you poke on them and they go, eh. And you have horses with no changes and you poke on them and they drop to the floor. So my point is that if someone sends you these radiographs and go, is this okay or not okay, that you cannot make a determination on it. You have to put the whole picture together. You can't just treat the x-rays or use those x-rays to label that horse. You have to have it be a whole thorough workup. And that's why I tell people, do not look kissing spines up on Google, because it will tell you this terrible gravity to it. And in reality, that is not. I think we get excited because now we are taking those images and we're looking at a lot of images, and this has to be the issue. But that's not the case so many times. There's so much more to it. And so I implore people to not just take that radiograph at face value necessarily.
You have to treat the horse. You can't treat the radiograph. You know, that's what you're taught in school, you know, treat the horse, what the horse is needing. You know, I can't remember what else I was going to say, but it's 100%. It makes pre-purchase exams very challenging. You know, nowadays, at least what I see, both in sport horse as well as in, you know, the racehorse sales, people want clean horses. They don't want risks. And anytime you have a radiograph or anytime you have something clearly that people can see, you know, they don't like it. And so it can be challenging to, you know, move forward and actually have that horse and I guess, in my opinion, really ride that horse if you know he has kissing spine. So my recommendation is do not take spine radiographs on pre-purchase unless there is some sort of in the history, behavioral issue, previous treatments, something like that. Because if it's not bothering the horse, don't touch it.
Hi, I'm a saddle fitter, so I pretty frequently have people coming to me because their horse has been diagnosed with kissing spine. So I have a couple questions relating to that. The first one, my goal with all horses, whether they've had back pain or kissing spines or not, is to put them in a saddle that's comfortable enough that they can get their back up and swing through the back and use all those structures the way they're meant to be used. So because when the back comes up, those spinous processes spread apart. So either avoiding or developing kissing spines or minimizing the discomfort. So my question is, how much of a range is there from one horse to the next, and how much spread there can be between the spinous processes when the back is up versus when it's down? Does that make sense?
Good question. No, I mean, meaning like, I don't know that we've ever had an opportunity to be able to really identify that, because imaging is such a challenge, let alone in dynamics. You know, I mean, we are pressed to get a good image, you know, statically, let alone in dynamics. I mean, you certainly can. Now horse's back is designed to have extensive flexion and extension. That's why the spinous processes are shaped the way they are. So through the withers to mid back, they're oriented in a way that is the dorsal spinous process is moving away from their nose, per se, from their head. Then there's something called the anticlinal, where it almost comes to vertical. And then as it travels down through their lumbar spine, it actually goes the other way, again, to clear a way for the back to have this flexion and extension. So the orientation of these dorsal spinous processes is very different, especially depending on the conformation of the horse. You've got breed dispositions that are make it totally different. You've got just the individual's conformation alone that make it very, very different. So we would own an island somewhere if either one of us could answer that question, because it is all over the board. What I see as a challenge for you as a saddle fitter, and this is my biased opinion, is especially with thoroughbreds, I see their top lines change, especially being in Kentucky. I see their top lines change dramatically through the year, which I wouldn't want your job. Because, and the reason I say that is thoroughbreds in particular are particularly prone to changing their meat over their top line and their with the seasons, right? When the grass blooms in the spring and through midsummer, how they put on back musculature is entire, or just even mass through their top line, is entirely different than after one winters here and maybe didn't get the best hay, maybe didn't get, you know, they just change so dramatically. I implore and the way we ride them here is entirely different. Some are fortunate enough to have access to an indoor, some aren't. When they aren't, I can promise you the workload is way different come usually December, not because of the weather, but because of the holidays. Everybody starts to tail off the second half of December. January, February can be a challenge, to get a good opportunity to work in the same level that you are this time of year. Then March, if we have an easy spring, or we have a mild end of winter, beginning of spring, people are all anxious to come out and ride, and they throw all their stuff on that they had from back in November, December. Now the horse's top line has changed dramatically from when they dropped off December to March. So I implore everybody in the spring here to check their saddle fit and check their equipment in general that time of year, especially. Then I implore them all to recheck it Memorial Day. The reason I put that out there is because they tend to change their workload and their back composition between the grass, between the conditioning, totally different. So I see a ton of back sore horses beginning of June. Why? Because their saddles were fitted for this narrow top line come spring. Then they've all filled out the whole front end of the saddles now pitched forward. Their weights come back. They're now sore right behind the saddle at their TL junction, and everybody's all up in arms. I just got my saddle fitted. Da, 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 da. And then, sound familiar? No. And I go, no. Let's not throw stones yet. So I just say, just plan on that. Just plan on that. You're going to at least have to reevaluate this 2, maybe 3, maybe 4 times a year, or at least set back and have a game plan for how you can mitigate these changes. I see it less dramatic in other breeds. I see it very dramatic, especially in Kentucky with thoroughbreds in the sport horse industry. Sorry.
Sorry, to follow up with that. It would seem kind of like a obvious answer to do a lot of basic dressage with these horses, again, to get the back up, to get the spinous processes apart. Is there a point at which dressage, like as you advance through the levels, where it's not so good for a kissing spines horse? And what about other disciplines?
I mean, I think when you answer with that question, all I can think about is the individual. There's gonna be some horses that are gonna be able to handle it and be able to perform and do that, and then there's others that are not. And it's just like all athletes, in my opinion. There's always a limitation to an individual. I don't know much just about dressage.
I'm definitely no expert on dressage, but I certainly know. Oh, so this is my thing. Too much of one thing is never good. Moderation is key. Basic dressage can be super, super valuable. In fact, that's essentially what half of the PT and core strengthening is, right? It's a true engagement. To get a horse to truly engage, balance, use core muscles, sit properly. But advancing dressage is not a cakewalk. I work on dressage horses and horses that are coming up through the levels in dressage, and it is hard. It's hard on their body. It's hard on lots of things, especially if you have a growing animal. We have to be really, really careful. And I think there was a comment that came up about the racehorses and it being hard on them. I actually see it harder in some of my dressage horses, the movements that they have to do. And it has to do with tighter circles. It has to do with their composition, particularly in like an SI joint, a sacroiliac joint, right? So the pitch of that ilium as it interacts with their sacrum, just in the back, it can really be an issue through that whole ligamentous joint if you're doing tight circles, a lot of sitting, a lot of transition, you know, when you get into pirouette work, when you're doing a lot of lateral work, people underestimate how difficult lateral work can be in a horse, especially if they don't have the basics. So it's what you're talking about on the basic scale is super valuable. But we have to be very careful when we get into the advanced movements, because they can be extremely difficult on a spine.
I was wondering what your guys' thoughts are on hog-backed horses and like pain down the road that they can come upon, kind of, and their agility, basically, like how you think they would perform and basically how they would hold up over the years.
I have personally ridden race horses with extreme hogbacks, so to say, very technical term. But so I mean, we'll just talk about kyphosis and lordosis. Okay, kyphosis, roachback horses, lordosis, you know, swayback horses. You'd be surprised. I'd venture to say I almost see more back soreness in the swayback horses, but I hate to even blanket term that, because I've seen some do very, very amazing things, and when you sit a saddle on them, you barely even notice it, you know, and you sit very comfortably in there. And as far as your horses with kyphosis or roachback, it is impressive how well they can make. I've ridden successful race horses with it. Now, that being said, mechanically looking at them, it's not going to be the most efficient movement, right? You have to think of the spine from the bow and string perspective. Okay, so you've got a bow that you're going to pull up back, and the musculature is the string that you're going to let go. So there's stored energy. There's stored energy through that back. All right. Anytime you have that kind of conformational change through your spine, it's going to change the amount of stored energy and the range of motion they have. So if we were going to do dynamic kinetics on these horses, you'd probably see a change. So it's not the one that you would necessarily pick and say, that's my next Rolex horse or Land Rover. That's my next Land Rover horse, you know, or that's my next, you know, Breeders' Cup horse. Those people shy away from those horses if they're looking for that caliber, because kinetically, mechanically, it doesn't compute. But it's also not a deal breaker either, in my opinion, in my experience. I don't think that helps. But it's all about your expectations, right? I always say, what are your goals? Is your goal to go to, you know, 5-star level eventing? Okay, well, you know, but maybe you got this horse discounted, so maybe it's worth the gamble. So it's putting it in perspective.
I think it just goes back to the individual. I mean, there's always going to be outliers. There's always going to be horses that, you know, have those conformational faults that can live with them. You know, you see it with other musculoskeletal disorders as well, you know, and, you know, just, you know, toes out, toes in, you know, all of those things, you know, and so I think it's like, what's your main goal? You know, where are you trying to achieve? You know, are you wanting to have the satisfaction of, you know, taking a horse that may on the outside look like he's not going to be able to perform or get to the level, and work with him and take the challenge on and make it work? You know, that's the satisfaction you'll get. So.
And I'm going to refer back to my mentor, who I did my internship with at Root and Riddle, was Scott Pierce. And he used to, when we were pre-purchasing horses, he would look and he goes, half the time what we're focusing on, you know, that OCD, that confirmation, this, he goes, that's not what's going to stop this horse from performing. It's going to be that he ran through the fence or that he, has the abscess you can never, it's the things that you can't. So you used to say you have to let people buy horses. In other words, you have to, it's meeting expectations and goals, Now, are you going to pay $500,000 for a horse that has a ginormous OCD? And no, you got to mitigate your risk. But at the end of the day, you have to put it in perspective, and I think we're starting to finally move away from the trend that we're going to black mark every radiographic change we see, we're going to move away from that and put it in perspective.
My question would be, how often do you see a correlation between back pain and decreased lateral flexion at like C4 and below? And if so, does it correspond like C4 to thoracolumbar junction, C5 to lumbar, C6 to SI or lumbosacral?
Yeah. Okay. No. So it isn't that blatant, those segments back to it is. I don't find that pattern to be quite so blatant. The patterns that I find to be blatant are low limb changes to different segments through the spine. Blatant patterns for me: foot pain, actually pain from the fetlock down. Blatant pattern. I see changes in lateral flexion, C6, 71. Okay. And how I explain it is that, like, say you have a foot sore horse or a horse with pastern changes, ankle changes. What they'll do is, okay, generically putting the number out, they put 60% of their weight on their front end. So what they're trying to do is alleviate some of the weight and the pain in that region. So they'll pull themselves off of there. Well, how do they pull themselves off? They use their lower neck to do it. All right. So I see that. I see different changes with knees or heel pain. They tend to pull themselves back. They tighten through their triceps. They're tightened through their pectoral. They tighten through their trapezius. So I see a ton of low wither, transitional segment changes. I see changes in their sternum. Generically, hock pain, they tend to go a little bit base narrow. They get I see changes through that mid back region instead, closer to their anaclinal, different. So I see correlations with that rather than there being a correlation to specific segments in the cervical spine that translates to different segments down the rest of the axial skeleton. But what prompted that question? May I ask? Right. And I see that show up in the soft tissue well before I see that show up in the spine. So, and that's, and that is why it's brought up in osteopathy and different, in different therapies having to do with the body. But I see it show up way more in the soft tissue before I do the actual spine mechanics. It is, but you can drive yourself a little crazy with that because it is, to me, it's good to note markers of change, see patterns, see consistency. Because I have seen people go crazy with their shims in their south because there's asymmetry through different, and we actually trigger other problems. So, it's that gentle titration here and there because I mean, when I say you can drive yourself crazy, like I've seen people there measuring heels with rulers and, and then marking their saddle pads and then doing and to try to fiddle with the symmetry. And when we put that much effort into the basics, we get more results. If that makes sense.
And I have another question from our online audience. Kathleen wants to know if ovarian issues in mares can present as back pain. I don't know if that's any of your areas of expertise, but
Yes, I have seen some mares that with their cycle and stuff, they do exhibit signs of back pain, or what people refer to as back pain, but it's not truly back pain. It's more ovarian pain or internal pain. So I do have some horses that, that is one way of conservative treatment is with hormones that people do treat back pain with. But are we treating the back pain, or are we treating the reproductive? Yeah. So I think that's where you get, that's goes back to the importance of what are we treating? Back pain, ovarian pain. So, because it is, I'm not a woman, but I know it is painful. At times you can, when you're just palpating, and when they're ready to ovulate, those ovaries are painful. So.
And it sounds silly, but even as a chiropractor, but then this is my veterinary hat, is that one thing, especially if I'm treating a 2-year-old, 3-year-old filly on the track and she's presenting with lower back pain. One of the first things I'll do is check and see if she has a Caslix, or check even her conformation under the tail, because any kind of urogenital inflammation can trigger lower back pain, localized soft tissue muscle spasm, which I might find changes in that lumbar spine, but I can adjust that lumbar spine till the cows come home. And if we haven't addressed that inciting issue, it will make me look very bad at my job, because the back pain is going to come back. And so it's super, again, it's putting the whole picture together. So 110%. Urogenital inflammation can show up as lumbar fixation, lower back pain, quote unquote, and be left unaddressed if you haven't looked for that to be a cause. I see very interesting patterns. And when I say patterns, I mean fixation patterns chiropractically through horses with EPM. Back pain actually tends to show up way further down the pike. One of the first things I see is loading signs through their limb, meaning as I'm adjusting through lower limbs, I see coffin joint fixations, I see knee fixations, I see shoulder fixations, see tons of hip fixations. Why? Because they're subtly catching themselves off balance and jarring through their body. And it may not, we may not be picking it up with the naked eye. It may be when the lights are off and they're meandering in the field and they're stumbling, bumbling around, or they're in their stall doing, and it doesn't need to be a dramatic thing, but it's those patterns that develop and show up in the body are patterns that are subtle accumulations over time. So I actually don't see it as blatant back pain until it's gotten much further down the pike, or they've lost their top line, right? How many times have we seen a horse that has succumbed to an EPM burden, and it's one of the first signs is there's not as strong. Well, guess what? That their core strength just went out the window. So what happens? They're going to get back sore.
I would agree. The EPM cases that I deal with and treat don't present with back pain. They present with lamenesses or atrophy or something like that, way farther before they present with back pain.
do we have any other live audience questions before I continue with our virtual ones?
Serapin I've used it a little bit in certain cases, but it's not my go-to.
it had become a popular treatment option for a while. I have seen it. I mean, I don't personally use it because that's not in my not my forte. You know, I have other tools. But I have seen the trend go other directions, which usually means it's not quite as effective.
Can you repeat the question?
Yeah. So her question was, are we seeing more kissing spine because of, you know, genetics, environment, raising how these horses are being raised, or is it just that we have better diagnostics? And kissing spine is not new. It's been around forever. There's horses that are on the post-mortem floor, necropsy floor, that have never been diagnosed with kissing spine that have kissing spine. I think we're seeing it, and it's a hot topic now because technology has allowed us to have x-rays in the field. You know, I've only been in practice about 6 years, and the stories that I hear of how they used to take x-rays, lugging the big plates around, the big generators and all those things. Now I have, like, you know, a tablet that pulls the images up within 20 seconds, you know, in a little generator that's, you know, about the same size as the tablet. So, and I can get most images of the back that I need. And so people are looking for it more. So I think you're seeing it more and hearing more about it because the technology allows us to. Diagnostics are there. So, and I think that's a good thing in a way that we can have answers for owners. But I also think it goes the other way where it's a little bit too much of a good thing's a bad thing. And like I said, the horses that I know of that truly have back pain, that are treated consistently, back pain, there have no other underlying thing. You x-ray their back, normal. Ones that look horrendous and you think, oh, we're gonna have to treat this every other week, never treated.
And just to go a step further down on the imaging, I always implore I'm never going to ask a client not to do imaging because, you know, it's kind of nice to have that tool. But I always say, you only take image, you only do certain types of imaging, you only take x-rays if it's going to change what you're going to do ultimately. So it's a little bit along the lines that don't look for a problem if there isn't one, but also, you know, don't take the radiographs, don't do the imaging unless it's going to change what you're going to do. Meaning, you know, do we have to make a decision, you know, to do a surgery or not? Okay, that's going to change what you're going to do. But if you haven't done some of the basic steps before that, if we haven't done the respis and the core strengthening and the chiropractic and the acupuncture, and, you know, maybe incorporate the shock wave or, you know, like you said, doing the diagnostic, if you haven't done those steps first, then you might be at a loss to jump straight to the imaging, because that's not going to tell you the full picture by any means. And it may complicate it, actually. May complicate it a lot.
And the other thing with radiographs is your technique of how you're taking the radiographs, positioning changes a lot. I've had horses sent to, you know, referral films, you know, pre-purchase done in South Carolina, send me the film, say, hey, horse has kissing spine. You know, we knew it did, we bought it. We repeat the radiographs in the clinic, and there's no evidence of kissing spine. And if you go back and you really evaluate those radiographs, it's the angle, you know, the positioning of both the plate and the generator to get those images. And so that's what I see far more of, is an overdiagnosis of kissing spine due to poor technique, or just, well, this is something we can see, we're going to treat it. And the horse. For a long time, kissing spine, and it even still is, it's considered a curse for an athletic horse, for a performance horse. Like if it has kissing spine, you're done. And I don't believe that. I don't believe that it's an end all for the horse. There are certain cases that it is. There are certain cases that are not going to perform, but there's a lot that we can do nowadays to get the horse through. So. Probably 90% of the x-rays that I take are all in the field. So yes, I do feel like with proper technique, you can get appropriate images. There are some cases, depending on the body mass of the horse, and even in like electricity in the barn can affect your radiographs. And so there are certain cases where, unless you're within a hospital, in a clinic with a larger machine and stuff, that you're not going to get the adequate imaging. But I would say nowadays, the majority of veterinarians, ambulatory veterinarians, have the technology needed to get appropriate films.
We probably have time for another question or two before we have to wrap this up. What was the question?
She asked if riding bareback was bad for the horse. I don't think that has any negative side effects.
So that would definitely be my short answer. I would follow it up with, not everybody rides the same way. So, I mean, I have legged up 180-pound men and a 90-pound soaking wet other person. And that 180-pound man actually rode more balanced and was easier on the horse's back than the 90-pound soaking wet person. So, so it really, like, I will tell you this, I work on a lot of therapy horses that are literally doing walking, stopping lessons with somebody who's, compromised in balance or proprioception. Those horses actually need a ton of chiropractic care because they are dealing with an unbalanced rider. And this is just walking. So that's my only caveat to that, is it totally depends on the balance and the strength of the person, whether it's going to be an issue or not. And again, it's moderation. I think if all you did was bareback ride, there would be some kind of secondary effect to that. So it's cross training. It's, changing it all around. So can I ask what precipitated your question? Do you have an experience with this?
I was trying to develop a more secure seat
Mhm.
because I had a couple falls last year that weren't so great.
Not fun.
And so I just wondering, it's like a once a week thing on a lesson horse. So
I
but
would not.
in general, I've heard a lot, people saying there's no saddle to distribute the weight and it's not the greatest. And I wasn't sure.
Yeah. And once a week, again, it's where we see trauma issues, where I see it, where I presume you see it, is anything that's repetitive, right? Repetitive movements. I always say, if you were a secretary sitting over desks tapping away, you're gonna have issues in your low neck, your low back, it's the repetitive. My race horses that are constantly training counterclockwise, I see specific patterns that deal with that. When you're coming in once a week, I don't consider that repetitive trauma. Okay.
Sounds good. Thank you.
We have one more question, anybody?
Do you think that steps versus climbing on from the ground is helping the horse?
Yeah, mounting block. Yeah, like between the hog back and the steps. No, I know. No, I know. I was gonna say, where are you from? No, I know. Welcome. No, 110%. It makes a big difference. I mean, I see changes through the spine. I can almost tell someone who's mounting from the block. I mean, I always say a horse, a body doesn't lie. A horse's pattern through their body doesn't lie. So I can tell you right off the bat if somebody is mounting from the ground versus mounting off a mounting block, just based off some of their compensations through their withers. Mm-hmm. Yeah, yeah, definitely. Yeah, fair enough. Yeah, yeah. I mean, we do what we can. Like, I'm not, don't lose sleep if you are mounting from the ground, but yeah. Should get your horse adjusted. No, I'm kidding.
Do we have anything else? Well, then we'll go ahead and wrap this up so that we can,
We may have missed it because we weren't here at the beginning, but you've heard mention of core exercises quite often. Is there specific ones that you recommend, or is there some place we can go look that up if we missed that information?
She probably has a lot more specific ones for you, but the book I love is Activate Your Horse's Core. It's Hillary Clayton. Very easy to follow instructions, sternum lift, belly lift, all those things. I don't have enough horses that I follow along closely in a rehab program to really see a horse from start to finish in there, but I've been able to give that book to a few clients. They've used it and the response back has been good.
So in general, Hillary Clayton is the woman who has written the books literally on it and does all that and very well researched, very, very well spoken. So that's kind of the beacon in the core strengthening in physical therapy realms. That being said, like it's also, core strength has to do with them being collected and balanced. And that's where, all the systems have come out, the PSOA, the Equiband and things like that. That has all been coined off this push to do core strengthening. I also push clients to be aware and train for proprioception too, meaning that unconscious awareness of where their feet are going. And you can do that, and it does wonders for the core. You can do that with ground poles, for instance. People negate the importance of backing, and I don't mean back down the side of your arena. I mean backing 3 steps. And people underestimate the importance of transitions. Your walk to trot transition, your transitions downward. People underestimate the importance and what you can get out of just walking, literally, having them stretch long and low, then collecting back up, having them stretch long and low, collecting back up, working over different surfaces, how a horse works through a sand arena versus, over turf is entirely different, over a synthetic surface, entirely different. So how a horse works their core and works their proprioception is totally, totally different under those circumstances. And I think there's a lot of value to cross training, because anyone who has solely run on a beach constantly will end up with specific issues from running on that beach versus someone who solely runs on blacktop all the time. So it's amazing what we can get done with cross training on different surfaces, cross training through different disciplines, because even your jumpers are doing a ton of flat work for all that reason. Does that answer your question? Help you get started? Okay.
Thank you, Dr. Carroll and Dr. Thacker, so much for your expertise. And thank you to Rood and Riddle for sponsoring this session. And if you entered the raffle for door prizes, Julia will be coming around.
We have an Al Miller.
And we'll have a short break before the next topic, which is nutrition.
Thank you.